I've been seeing a lot of people waking with a sore jaw. They're waking up with clenching their teeth. They're getting headaches, which are like around here, temporal. Now, this is what we call bruxism. They're headaches contributed mainly by clenching your teeth. So if you're a clencher, there's a few things you can do to actually self-diagnose and a few things you can do to actually help yourself. We see a lot of people in the practice that get headaches, and look, man, they're the worst. They rob of your vitality. They stop you from being the person you want to be. They don't allow you to play properly with your kids, or you're not as productive at work. They're just a real pain in the butt. So anything you can do to reduce your headaches, and these ones here are really not that difficult. And unfortunately, I see a lot of people that are getting them like week in, week out. If you touch around your temples and you can press and you can feel the meaty part through here and it's tender to touch, you're probably clenching your teeth. Waking with a sore jaw, you're probably clenching your teeth. It might be more subtle where you don't actually feel it, you don't have a sore jaw, but your partner's saying you can be making these noises during the night, like you're grinding or something like that. It might even be less that you haven't noticed it, your partner hasn't said anything, and maybe it's your dentist has said you're actually wearing your teeth down a little bit. They might suggest a bite, like a mouth guard, which is great because it'll protect your teeth. It's cheaper to replace the mouth guard than it is to replace your teeth, obviously, but it doesn't get to the underlying cause. So there's a few things you can do to actually ramp down the amount of stress in your body that's actually leading to the actual clenching and grinding. So that's what I want to talk to you about today. There are a few things that can contribute. You can have a misalignment in the jaw, which means that it's not closing and opening straight. It's going on at an angle, or it does like a bit of an S-bend. The most obvious thing or cause or contributing factor when you ask people is like, oh, it's stress. When I get stressed, I start to clench, or I grind my teeth. Now, that's true, but there's a caveat. If you can get your body to deal better with stress, it's not going to have the same reaction. There are things that you can do to reduce your stress levels: meditation, make sure you go to bed at the right time, get an adequate amount of sleep, whatever that's right for you, whether it's 6 hours or 8 hours. Consistency is the key. Same time up, same time going to bed effectively. Looking at your diet, not too many uppers, not too much coffee. That's a big one. I worked in Italy and they're having 13 cups of coffee a day and wondering why they're clenching their teeth. No brainer. That's easy, right? But other things like work stress, family stuff, relationships, there are things you can do to help calm your mind. Lots of apps out there. See a mental health counselor. My job as a chiro is that if we find any areas in your neck which are causing subluxations, anything that's affecting the nervous system, especially in the upper cervical area, which affects vagal tone, it'll ramp everything up. You'll be in a fight response. So the same thing will cause more stress, more tension, and more likely to clench. So thousands of people over the last quarter of a century getting neck adjustments, having some work done to cranials and jaw, getting less headaches. It's up to you to try and reduce the things that are ramping it up. But if it's neck related, it means getting a headache once a week instead of 3 times a week, or once a month, or not at all. Now, there are multiple factors, because it might not just be in the temples. It can be coming from your neck as well. I feel like suboccipital, it's through here. There might be other overlays of migraines and stuff like that. You might say, well, it's my work. Well, it's your work and you're still doing the same work. You're still at a desk 8 hours a day, but now you're not getting the headaches. Was it the work or was it your neck? Now, the neck contributed and the work contributes. So there's a number of different factors. There are things you can do yourself. Palpate these areas here where it's like tender and just massage it down. You'll feel it, feel really good. You relax your jaw. There are muscles that I work on, the internal pterygoids. You release those. It's like someone sticking a needle in your eye. It sucks. It really hurts. But man, does it take the jaw off the boil, and it really, really relaxes things and can really help with the headaches as well. Simple things. Chewy food, chewing foods on one side, eating hard stuff, things that you have to really bite down on, chewing on chewing gum all the time. These things, if you're clenching or grinding, maybe give them a rest and give your body a bit of a chance to recoup and recover those jaw muscles a little bit. Jaw stretches, you can do them. Sometimes they help, sometimes they just make them worse. For the most part, we've had really good results. If we can find that it's a problem in the neck or in the jaw, it can have a big impact on your neck. Obviously needs an assessment. Like I said, there's multiple factors. Chiro really shines when it's blended or mixed with self-care. You recognize that this is part of the issue. There are things that you can do to help the issue as well. You get those two things together and you're getting a better quality of life, less headaches. You get to be the best you can be. I hope this has been useful. You might know someone that's suffering with bruxism or jaw-related headaches, and pass the video on. If you're ready to make an appointment, just click on the link in our bio. I'd love to help anyone in our practice. It'd be great to see you. We get lots and lots of experience with this sort of thing. Just reach out if you need.